So I'm Michael Glotzbecker. I'm Division Chief of Pediatric Orthopedics at Rainbow and Babies Children's Hospital, and I do a lot of spine surgery and scoliosis correction work. So scoliosis bracing is a non-operative way to try to control your scoliosis from getting worse. It's a brace that's made specifically for you. It's a plastic brace that is designed for both your body as well as your curve. It squeezes on your curve and tries to keep your curve from getting bigger and tries to keep it from progressing so that you can hopefully avoid other treatments. The reason you should wear a brace is because it's the only really scientifically proven treatment that is able to control the curve and keep it from getting worse. So some people with scoliosis end up needing surgery, but if you wear a brace, it gives you a very good chance of avoiding the need for surgery. So there's lots of different types of brace. The main way to think about it, there's some nighttime bracing and then some full-time bracing. When you look at the different full-time braces, there's some slight differences in how they're designed, but they're designed to be worn during the day and at night. The types of braces that exist, the most common would be a Boston scoliosis brace. That's probably the one that's used the most commonly. Many people use a brace called a Rigaud-Chenot brace or some variant of that. That brace is similar. Its design is just a little bit different as far as how it pushes on your curve. And then the nighttime braces are a little bit more asymmetric, so they're a little bit more planned or designed so that you wear them at night and not during the day. So when it comes to how long you should wear the brace, most people feel that you should wear it about 18 hours a day. That's because the more hours you wear it, the more effective it is, and that sort of just makes sense. There are some people that do some nighttime bracing, but for the most part, we feel that wearing it about 18 hours a day is the best option. That usually means you wear it during the day, maybe to school, and then overnight, but we do encourage you to take it off for all of your activities and fun things you like to do. So we look at how the brace is working in a couple different ways. So usually when you get the brace, we take an x-ray in the brace and we see how effectively the brace actually pushes on the curve. So we expect the curve will look smaller once you put the brace on. And then over time, you generally watch kids. We watch you every 4, 5, 6 months, take x-rays every so often, and we make sure that the curve is not progressing. If the curve is not progressing or getting a little bit better, then we know that the brace is probably working well. So sometimes even if you are the best brace wearer, there are a certain percentage of curves that will continue to get worse. And if that happens, some of those people, one of a couple things can happen. Either you'll stop growing and the curve will be small enough that you don't need to worry about it in your future. But occasionally, even if you're a very good brace wearer, those curves will get worse. If it gets to the range where it's up around 45 or 50 degrees, sometimes you will end up needing surgery for it, even though you did everything that you could to try to prevent the curve from getting worse.